Hey, how are you doing? How are you doing, my personal person? So I've missed you. I decided today I'm gonna bring another topic and we're gonna discuss about travel nursing. Guys, this is a very interesting topic, and yeah, I just wanted to tell you something about my culture. Now, in my country, where I come from, this is the perception of people. Whenever they see somebody with a big stomach, they think that person has a lot of money, okay? A lot of money. But even us nurses here in the USA, wherever we see or hear somebody is a travel nurse, oh my, we think that person has a lot of money. Just like this guy coming from behind here. Guys, it's nice to meet you. My name is Bosco. I'm a registered nurse here in America. I'm also a registered nurse in Kenya and Uganda. I'm a nurse who helps other nurses abroad and guide them on the step-by-step process on how to make it here in America. I'm also a digital businessman, so those who want to join me in the business, those who are already in diaspora can join me in the business at boscoemmanuel.com. All right, let's go to my computer and learn all about travel nursing. Let's go now. All right, guys, we are live. Yes, so yes, we are going to answer the question of what travel nursing is and what the salary of a travel nurse is. So yes, let's go straight to the topic. Just a few something small here. Yeah, so first things first, what is travel nursing? So no need to torture your mind with useless definitions, but I can explain that in travel nursing, you as a nurse, you sign up with a travel nursing agency, then that agency contracts your services to a facility. It can be a hospital within your state, out of your state. It can even be a hospital outside the United States, depending on what your preference is. So, and as a rule, that facility must be 50 miles away from your home, or what we call here a tax address. Yeah, but sometimes you may want to do travel nursing and the facility where you want to work is less than 50 miles. Say it's 10 miles drive away from your home. Then that one is known as local travel. So with local travel, you do the job, yes, the same way as a travel nursing contract, but you don't get the stipends. You will not be given meals allowance. You will not be given housing allowance. However, local travel nurse jobs usually pay slightly higher than staff nursing jobs. Yeah, that's how I can say what travel nursing is. So travel nursing can be, a typical travel nurse contract or a local travel nurse contract. However, with local travel, you don't get the allowances. So, what are the requirements for you to get a travel nursing job? Number one, you must be having at least 1 year of experience. Yes, the more the experience, the better it is going to be easy for you. The easier it is for you with that job because, with travel nursing, you're given 2 days of orientation and you are expected to be on your own. So, if you have good experience, it will be easier. And then you must have these certifications: BLS, ACLS, PALS, NIH. Actually, those nurses uh, who do not have these certifications may not actually you may not even work in a nursing home without BLS. So these are mandatory for all hospitals. If you want to work in a hospital, you must have BLS, ACLS at least. And if your work is going to involve children, then you must have PALS. NIH is especially for people who work in a unit that is going to deal with neuro cases, stroke. That one you must have the certification as well. So if you want to do travel nursing in future, start working on these certifications so that you have them. And then you must have a resume. I believe each of you has a resume because you have worked somewhere, you have an educational background. So no need to dwell too much on that. They usually ask you for referees. Typically, they want people who have been your supervisors, like your manager and charge nurse, but they don't like you to submit names of colleagues who are at the same level with you. Yeah, so you get at least two, you are good to go. And then they want vaccinations. For you to land a travel nursing job, you are asked for your vaccinations, especially COVID. Some of these jobs need you to submit a COVID card, a flu shot. You must have been vaccinated against flu. So um, prepare your documentation well in preparation for your travel nursing job by having some of these vaccinations. All right, guys, let's talk about the pros and cons of travel nursing. So, everything has advantages and disadvantages, but let's begin with the good things. The good things. Number one is adventure. Adventure, as the term itself explains, this is travel. Travel nursing. You're going to leave your state and go far, or you're going to leave your home and go somewhere else to work. But also during your time off, you can have time to do adventure. For example, you may leave, say, if you stay in Maryland, you may work in Mariana Islands and discover and tour and interact with people there, and enjoy all the attractions there. Or if you stay in Ohio, you may go and work in Florida and then enjoy Miami Beach. Okay. Yeah, so adventure is a very attractive factor when it comes to travel nursing. The second advantage is that travel nursing, travel nurses are paid big money. Yes, these guys get good money, every week, in thousands of dollars coming into their pocket every week. So that's an advantage. It's good to know that you're working hard, but your hard work is properly being compensated for. And then the other advantage or the other pro is experience. So for every assignment that you work on with travel nursing, these are short term contracts. You're going to work 3 months in a facility, but in that facility, you meet different patients, you meet different conditions, and each condition gives you an experience of how to handle such a patient. So by the end of that contract, you are really experienced, and then you go to land another contract in another facility. Then you see the way of life there. So by the end of, say, 5 contracts, almost you know every aspect of nursing in the United States. You have a lot of experience, and that makes you, be in the top percentile. You are so good at your thing that you are now a hot cake. Every facility will be fighting for you. Yeah. So the other advantage or the other pro is short-term contracts. These are short contracts. There is something good about being in a place for a short time. Even if there is something you don't like about the facility, somebody who is, very difficult to work with. You just tell yourself, after all, I'm here for 3 months and I'll go away, no big deal. But if you are a staff nurse and you're going to work in a facility for years, then then that becomes an issue, because you're going to work with these people, you're going to work with this facility on this unit for a long time, despite the fact that you don't like the place. So that's the advantage of travel nursing, short time and you go away. Yeah, what about the cons? Yeah. So as I said earlier, with travel nursing, you're given very little orientation, usually 2 days, and then you are on your own. So uh, there is a lot that you don't know. You're going to be asking a lot of questions, and here in America, I realize whenever you appear like you don't know what you're doing, you don't get a lot of respect for your work, in your work, by your colleagues. They don't, even for us, we are nurses, but those nurse aides, they will not respect you. Your colleagues, they will take you as the underdog. You will be treated in a funny way. So it's a disadvantage if you're not given enough orientation, because when you start working on your own, you will face certain difficulty. So that's not a good thing. And then that makes you also be prone to making mistakes. And remember, you're defending a license. Yeah, the other con is, in travel nursing, you are allocated in rough areas. Sometimes you are allocated in rough units to work with. By the time they say, oh, this unit is understaffed, let's bring in travel nurses, they have seen that the turnover in that unit is so high. People don't like working there, so they bring in the mercenaries, the travel nurses. And then, uh, so that unit could be very hard, could be a rough area to work on. It could be that the unit is short staffed, so you're gonna be given like maybe 7 patients, 8 patients, and that's not very good. And then the other disadvantage is that most of the time the facility requires the travel nurse to be floating. So you are used to a unit, say a med surg unit, and then they are like, oh, there is another burns unit. The nurse called off today. Uh, Please, the other nurse should float there. So you are taken to a burns unit all of a sudden, or you're taken to, if they see you have some ICU experience and they are lacking someone there, they may take you there that day. So there is a lot of floating. I mean, floating will be made to similar units where you have some experience. However, wherever you go to a new unit, it's a disadvantage. You want to work on a unit that you're used to, where things, you have a routine. But when you're taken to a new unit, then it becomes a disadvantage on your side. Then you may face staff nurse rivalry. These are guys who have been working in that hospital for 5 years, 6 years, and you are coming to work there for a few months to make a lot of money, better money than what they are getting, and then go away. So they don't see you as part of them. They see you as somebody who has come to earn better money and go away. So so they may not give you good reception. So what you do, guys, try, once you become a travel nurse, try to blend in, try to show them that, hey guys, I'm part of you. If they have a function, attend it. They have something they are contributing to, give in some few dollars to show that you are part of the team. Otherwise, it will be very hard. It will be very hard on your side regarding these nurses. And yeah, some travel nurses, because they have a lot of money, they go they go and show off, expensive items, they show other nurses that they are rich. For God's sake, try to avoid showing off and showing those other nurses that you are rich, that you don't want even to associate with them, because you have brands of items that are very, very expensive. They will not like you for that. And then the other con is that you will go to a unit with low nurse patient ratios. Most of the time, the units that employ travel nurses, these facilities have units with which are facing a problem of understaffing. So you will be given a lot of patients. The moment you start having 7 patients on a med-surg floor, it becomes very hard. Remember, each patient has individual circumstances. Each patient is unique in a way. They have their demands. So the moment the number starts increasing from 7 and above, then you start being ineffective, and the more you become unsafe for the care of that patient, and the more your license starts getting into jeopardy. So remember that as you contemplate on working as a travel nurse. But if you have a thick skin and you can push yourself to work extremely hard, then travel nursing is for you. All right. So, which agencies are employing travel nurses? Guys, there are so many agencies. They are all like, they are all scrambling for the available nurses. So, uh, these are some of them. You can pause the video to see their names. I will not mention each name here, but those nurses who are listening to me, and you guys who are watching me from the United States, know that your phones are already being bombarded by messages from these travel nursing agencies, because they they make money because of your work. The moment you enter that facility and you clock in, they are also clocking in. So each of the hour you work, they are also making money. Say if you do 1 hour and they pay you $80, $90, they are also making another $50 out of that. So, it's a win-win both for the agency and for you, the nurse. All right. So what is the salary of a travel nurse in USA? Yes, this is the main part of the presentation. All right. So that amount you're going to be getting per week is broken down as like this. So um, just the way you were being paid regularly before you went for travel nursing in that facility, in that hospital as a staff nurse, you were being given a regular pay. Say when you apply with the hospital, they say we are going to pay you $40 per hour. Even when you start working as a travel nurse, you will be given a regular pay. Say $40 per hour, say $20. I doubt you'll be getting that low. $30 per hour. Yeah, travel nursing usually is somehow they try to help you to avoid being taxed too much. So you'll get a regular pay of maybe, let's maintain $40 per hour. So and then on that, you will get allowances. Now, these allowances is where travel nursing becomes the deal, because you get an allowance for meals and you also get an allowance for housing. And then some agencies can even give you additional monies. Some of them give you money for gas or for fuel. Yeah, but not, this is not usually too much money. Maybe 200 a week. Yeah, but that's also something. And then some agencies may, after you finish your contract, they may give you a completion bonus. So before you sign with that travel nursing agency, ask them, do you give completion bonus? Yeah, that can be an advantage to them if they do that. So that's how we break down the salary of a travel nurse. Yeah, regular pay and then the allowances. So let's, for example, look at this job. This is going to be our benchmark in order to explain how much a travel nurse earns. So put it in your mind that nurses work 40 hours a week. That is the that is the standard requirement, 40 hours a week. Now, whenever you work beyond 40 hours a week, it becomes overtime, and there is a special payment for hours worked overtime. So just put that at the back of your mind. Now let's go to the money. So this job requires two positions. It's in this hospital, and they need you to work 48 hours. So for those, if you work for those 48 hours, they are going to pay you 3,734 and 52 cents. So that's what you're going to take per week, or for every 48 hours you work, or for 4 days, 4 days, considering 12-hour shifts. So let's see the breakdown. Like I told you earlier, there is a regular pay. So do you see this regular pay here? That's what you're going to get for every hour that you work in that facility. So, and this money, the regular pay, is taxable. The government is going to tax you for your regular pay. And so, we will see, if you work 48 hours a week times 46.51, you're going to get 1,860.4. I mean, did I explain it well? If you work if you work 48 hours a week, you're going to do 46.5 times the 48 hours. However, guys, remember, of the 48 hours, 40 is regular work hours, which gives you 1,860, and 8 of those hours is overtime. And how do they pay overtime? In overtime, they get half of this 46.51, half of that money, and they add it to the 46.51 in order to calculate what they should pay you per hour for each of the 8 hours you're going to work overtime. So that's why it's called time and a half. They pay you 46.51, which is time, and a half, which is half of the 46.51. So if we do calculate and multiply the time and a half times the 8 hours, it gives you 558. So in total, you're going to get the amount you worked for 40 hours plus the amount you worked for the 8 hours, and then you will get 2,418.4. So that gives you the gross amount you're going to earn per week. But because the government taxes this money, they will take something like 400 and then you will take home something like 2,000, okay? But now this nurse has earned 2,000 out of their regular pay. They are also going to get allowances, and allowances are not taxed. This money is taken home the way it is. The nurse may decide, if the nurse, for example, meals and allowances, the nurse may use this 483. The nurse may use, say, 200 for their meals for that week, and the rest of the money is for their pocket. The nurse may also decide that I'm going to stay in a very cheap place where I pay $400 a month, maybe get a small room somewhere from somebody's house, and so the rest of that is their money to use as they wish. So out of this money they've earned a week from their regular pay, they are also going to add 1,316 from the allowances, and that means in a week they are taking home 3,316. Is that not amazing? And then what about a month? If this is what they are getting a week, what about for a month? Guys, this nurse is going to take home $13,264 every month. So that's why we say travel nurses make a lot of money. So, and then they will do more 3 months, I mean more 2 months, and then they will jump into another contract, probably better paying than even this one. I know guys in California are getting like 4,000 and above out of these travel nursing jobs. So depends, the amount varies from state to state, from assignment to assignment, and from agency to agency. So look for the best pay. Get the best and then go for it. Go for it. So where do we find travel nurse jobs? If you want to find them, download an app called Vivian. These guys don't pay me at all, so I'm not advertising for them, but yeah, I'm trying to just give you information. So Vivian, and then there is also another app called Indeed. These ones, they will give you a lot of updated jobs regarding travel nursing. And then you can also join Facebook groups. In your Facebook, you type in travel nurse group, or travel nurse jobs in California, travel nurse jobs in Ohio, and then you can even customize it further by saying travel nurse jobs in New York paying 7,000 a week and above, and then you will see these groups appearing and you join them. So when these recruiters post jobs, you are the one who will be able to get the updates fresh. That helps you to get in touch with these recruiters in real time before the jobs are grabbed by other nurses. You can also network with other travel nurses. So every travel nurse assignment that you do, make sure that you get their contacts. Once they have something hot, they can notify you that, hey, are you interested in this? They are paying this 5,000 a week. Yeah, and then you can grab it. You can also Google the jobs directly, but the disadvantage with Google is that by the time these jobs appear in Google, just random Google search, probably they are already taken. The positions are already filled. So that's something just to put at the back of your mind. And guys, that is it. You have it. You have it all. Thank you so much for being part of this presentation. I hope you got some value from this presentation. I wish you all the best as you embark on your next travel nurse assignment. And please remember to subscribe, remember to share with a fellow nurse this presentation. Yeah, and I thank you so much for the support. Until we meet in another video, bye bye for now.